There's not one person that can ensure that these tests can be administered.
In the early hours of Saturday, the House passed a coronavirus relief package, 363 to 40, a bipartisan effort that got a go-ahead tweet from the president. It heads to a reconvening Senate tomorrow. South Florida Congresswoman Debbie Wasserman Schultz is with us to look at the details of that package. And in our new protective process, she is joining us from her district in Weston rather than right here in the chair. Congresswoman, good morning. Good to be with you this morning.
Good morning, Glenna. You too. Thanks for having me.
Thanks. Can you take us through what is contained in this bill that now heads to the Senate?
Yes, we passed the Families First Coronavirus Response Act early hours of Saturday morning, about 1 o'clock. What it does is it makes sure, first and foremost, that anyone who is indicated to need a test for coronavirus can get it for free, even if you don't have insurance coverage. And that's really critical because we want to make sure that people aren't avoiding getting tested because they're worried about how they're going to pay for it. It also makes sure that for businesses, large and small, it covers about 87 million workers for paid sick leave and up to 3 months of family and medical leave. About 14 days, 80 hours of paid sick leave, and up to 3 months of family and medical leave. It also provides unemployment insurance, robust increased unemployment insurance coverage for employees who have a gap in that coverage, a gap in their employment because of the coronavirus. And then it provides additional funding for SNAP benefits, for senior meal services, student meals, and just making sure that we can provide nutrition assistance, additional nutrition assistance during this difficult time.
So there is some concern that with all of that in the package, it exempts some of the larger companies. McDonald's, Amazon were some of the ones that were actually name-checked. It exempts those companies from providing all of those things to its workers if need be. What is that exemption about?
Well, there's no question that this was a vote that I know I cast and my fellow Democrats cast, where you don't let the perfect be the enemy of the good. Unfortunately, Donald Trump and Republicans really were digging in, and they refused to make sure that we could universally provide that paid sick leave and up to the 3 months of family and medical leave for all employers. They were insistent on exempting employers who employ more than 500 people. And, you know, the good news is that 89% of those companies in this country do provide paid sick leave for their employees. But, you know, we were in a situation where we could dig in and continue to insist, or make sure that at least tens of millions of workers could get that coverage and make sure that we were going to pass that bill and get as many people covered as we could. So it's very unfortunate that Republicans dug in on that.
Ridiculous. Well, and it sounds like that the compromise worked, and there is a bill going to the Senate that the president, at least on Twitter, says he supports, and so we'll look for that tomorrow. I want to, Congresswoman, ask you a question that we're hearing from some of our viewers as things start to batten down and businesses close and events are canceled. What do you think of what might be a crazy idea of a total national quarantine? I suppose not so crazy because countries like Italy and Spain are doing just that. Is that something that you all on Capitol Hill have talked about at all? And what is that possibility?
Well, I've been in extensive briefings with Dr. Fauci, our nation's foremost public health expert, and obviously had a chance this week to question Dr. Robert Redfield, the director of the CDC, both in the oversight hearing as well as in briefings. We are about 2 weeks, public health officials tell us, behind where Italy is, and it is a very, very serious and important thing for people to listen to. Social distancing, which means stay away from people around whom you do not need to spend time. That means limiting any social contact. That means, if you have to run to the grocery store, do that and come home. Don't spend time with friends you don't need to be spending time with family members that don't live with you, particularly elderly people. In direct answer to your question, we've not talked about that on Capitol Hill yet, but we are listening very seriously to the advice of public health officials. And Dr. Fauci did say this morning on national television that if we can't get the kind of significant social distancing for people to voluntarily comply with, even with the national closings and statewide closings that we've had, then you may end up needing to take that step. This is really serious. What we don't want to do is overwhelm the ICUs, the emergency rooms, and our healthcare facilities, and we could have that situation if we don't really practice aggressive social distancing.
Congresswoman Debbie Wasserman Schultz, great to be with you this morning. Really appreciate your time on this Sunday.
Thank you.